Today's topic in the series of approach to common presentations is about altered sensorium. So, any case brought to the casualty in view of altered sensorium, how to approach? Mainly, it is very important to ask about the pattern of altered sensorium. That is, we just have to ask in what form the sensorium is altered. For example, whether there is decreased responsiveness response, or whether there is decreased consciousness level, consciousness, or totally unconscious. We are talking about some acute presentation like 1 or 2-3 days history of altered sensorium. So this is very important because this form of altered sensorium will give a clue about some further plan or further workup. Then immediately we have to assess few things, especially the saturation. It is a very common scenario that the family members, whenever they observe individual in altered sensorium, they will try to feed them with some food or some water, thinking that the individual will improve. That might have led to the aspiration. So it is very important, and if it is low, we have to supplement immediately with supplemental oxygen. Then comes BP assessment, because especially in elders, some hypertensive encephalopathies might present with altered sensorium. The reason might be underlying stroke or even hemorrhage, etc. So important to look for BP. Then check for GRBS. Again in elders, because of hypoglycemia, the individual might be in altered sensorium. And here one more important thing is, suppose if we get GRBS as normal or even sometimes high, it is very important or crucial to ask the history of visit to some other hospital before presenting to you, because the individual might have had hypoglycemia for a long time, and during the visit to some local hospital or clinic, they might have infused with dextrose fluid, and after that they might have got the individual to you, so that here the GRBS might be normal. So that history is also important. So these are few things which we have to assess immediately. Then in examination comes, look for pupils, especially whether they are reactive or not, or some unilateral dilatation, etc. Then look for neck rigidity, and here we can consider even photophobia also. If we flash light over the eyes, the individual, even in altered sensorium, they will get irritated. So that is photophobia. Again, might give a clue about meningeal infections like meningitis. Then we have to observe for any paucity of movements. Just pinch the limbs, all 4 limbs, and try to look for paucity, because as we have just now listed out, sometimes strokes can present with altered sensorium. So any paucity, especially unilateral, will give a clue towards stroke. So these things have to be assessed immediately. Along with that, some extra history we have to take. For example, if the individual is having any liver diseases or renal disease or any features of infection, that is sepsis, like fever, recent history of fever, cough, or urinary tract infection, etc. Because even these systems might lead to encephalopathy presenting as altered sensorium, which you might be knowing, that is hepatic encephalopathy, uremic encephalopathy, and septic encephalopathy. And we have to ask for few initial investigations. For example, GRBS, which we have already told. Then ask for sodium, because hyponatremia or even hypernatremia can present with altered sensorium. Most commonly it is hyponatremia. And CT, plain CT brain, so that any structural lesions, if it is present, we will get the clue through CT brain. So these are few things we can just send for in the initial few hours. Coming to the management of such case, mainly as the individual is in altered sensorium, just secure the airway. If saturation is low, give supplemental oxygen. Then for the nutritional care, we can insert rice tube, and as the individual will not be able to mobilize, just use Foley's catheterization. Then in any of these initial assessment, if we get any abnormality, correct the abnormal values. For example, hypoglycemia, give dextrose immediately, and if there is hyponatremia, 3% NaCl can be used, like that. Then if we are having any doubt about sepsis, or if we get some neck rigidity in the examination, or even photophobia, so any features of infection suspicion, we can give first dose of antibiotic. There is no harm in giving this, because especially in septic shock, if we delay the usage of antibiotics, the morbidity and mortality will increase. That's why there is no harm in giving first dose of antibiotic if we are strongly suspecting some infection. And for rest of the causes, for example, if hepatic encephalopathy based on BP, we can consider giving enema. And if it is uremic encephalopathy, again we can ask for specialist opinion regarding dialysis, and we can go ahead with hemodialysis, etc. So this is the overall approach. So to summarize, whenever an individual is being brought in altered sensorium, first take just a short history, like how is the altered sensorium, whether they are responding lesser or the consciousness level is itself less. Then assess for some important vitals, especially saturation, BP, GRBS. Then look for some CNS related examinations, especially pupils will give some clue, neck rigidity and paucity of movements. Then send immediately for few basic investigations like sodium and CT brain. After that, we have to secure the vitals, we have to secure the vital organs and facilitate with some general care such as Rayleigh tube, positioning of the patient and Foley's catheterization. And meanwhile, if we get any evidence about the cause, we have to focus on that particular cause. Hope you have got it. Thank you so much.